Okay. All right. So again, my name is Dr. Jennifer Kallmeyer, and I am a naturopathic doctor here at the Reardon Clinic, as well as clinic director. My talk today, of course, is going to be on what is naturopathic medicine. I usually do a little spiel about how I ended up in this field. I'm from a long line of doctors in my family. And when I tell people, or when I go home or out in the public, I say I'm a naturopathic doctor, they always, of course, are like, a natural what? They have no idea what that means. They always ask me how I ended up in this field. So what I went ahead and did for the Health Hunter this month, I wrote a little article about, just a little story about how I ended up here. So if you're interested in that, you can go back to our Health Hunter online and read the November episode of how I ended up here. But what I want to do is spend the next hour talking to you about what naturopathic medicine is. How many of you guys have seen a naturopathic doctor before in the past? Okay, some of you guys have. Here in Kansas or in other states? Kansas? Everyone's okay. All right, that's great. All right, so this is our agenda. This is what I'm going to talk to you about today. I'm going to go over the definition, what is naturopathic medicine, education and training. I always get this question, what is your schooling? How much do you learn? Are you competent? Can you do certain things? So I'm going to go over our education and training. Treatment modalities, so that's just kind of what's in our black bag, so to speak. What do we use to treat patients? How do we get people better? We're going to go over the naturopathic principles. That's just, our beliefs, what that is. And we're going to go over our therapeutic order. In other words, how do I treat the patient, or the art of medicine? A lot of times that's forgotten. So that's more about how we see medical care as an art. And then I'm going to give you a whole lot of examples. I might not have time to go over all the examples that are on your PowerPoint, but I put a lot of things in there so that you guys can read and educate yourself and maybe leave and start doing some of these things on your own without even having a naturopathic doctor over your care. So that's just for your information, a lot of that. But before I go into the boring definitions, how many of you guys woke up this morning and thought to yourselves, wow, I feel good today, or I wish I slept more, or gosh, my back hurts, or gosh, this headache, or sinus problem? How many of you guys wake up thinking that in the morning? You probably do, and you don't even realize it. You make that initial assessment, how you feel. You don't even realize that you're doing it, but we all do that when we wake up in the morning. Is it going to be a good morning, or is it not going to be a good morning? So how many of you guys have also stopped to think, wow, what biochemical process or physiological process is occurring to make me feel this good or to make me feel this bad? How many of you guys thought about that? Not many. Well, a couple people do. Well, that's great. That's good. You've probably seen a naturopathic doctor, or you are in that field of medicine. But not many people do. But that's what, in a sense, that's kind of what we as naturopathic doctors try to do, is try to understand the workings of the body, why things are happening, what's causing it. So that's kind of, in a nutshell, what we do, if that's a decent description. So the reality is we all need to be healthy. So we all want to feel good, but health is not necessarily how we feel. How we feel is a result of being healthy. So health is absolutely a necessity in life. We need health. So figuring out the cause is definitely a necessity for everyone. And as I go along, if anyone has any questions at all, please feel free to raise your hand. I welcome questions. I like interactions from people. So please, at any point in time, ask a question, okay? All right, so here are two definitions that I like. So now we're going to go into the boring part. Naturopathic medicine specifically looks at the root cause of health and disease and seeks to restore, promote, and then maintain optimal health by using individualized natural therapies. So that's kind of a definition of naturopathic medicine. It's also a very good description of what we do here at the Reardon Clinic. So we also have medical doctors on staff, nurses, But as a whole, this is a description of what we do here at the Rudin Clinic. It's a very naturopathic type, hey Lana, approach to medicine here at the clinic. Another good definition that I really like, that people don't realize, is that we are based on science. We blend scientific knowledge with traditional and natural forms of medicine. So it's kind of like the best of both worlds. You know, we're not alternative. We don't see ourselves as necessarily alternative because we're just another specialty. We're another person on your healthcare team, so to speak. We specialize more in the natural aspect. We understand how herbals work and nutritional biochemistry and all those things. A lot of things that conventional doctors do not learn in medical school, or if they do, they don't practice it, so they forget it. So that's kind of what we do. We're kind of the best of both worlds, but we're more of a specialty. We don't try to take over primary care. Okay? I always tell people we're another set of doctors that you can get another opinion from, because it's always good to have multiple opinions when it comes to your health care. Okay, so let's go ahead and start talking about the education of naturopathic doctors. I always get asked this question. Naturopathic doctors, if you're licensed and regulated in states, it's a doctorate program, so it's a 4-year doctorate program, very much like medical school, conventional allopathic or osteopathic medical school. First 2 years, you have first of all, you have all your prereqs that you have to get an undergraduate degree, okay? You can't just be a high school graduate. You got to have your undergraduate degree and all your prerequisite courses, the fun organic chemistry and chemistries and physiologies and all that stuff. You have to get accepted into a 4-year full-time program, doctorate program. We have 45 hours of classroom training and over 1,500 hours of clinical experience in the 4-year school, okay? So the first 4 years, very similar. The first 2 years, you learn all your basic sciences, cardiology, anatomy, physiology, histology, all those ologies out there. You probably don't know what they mean, but you probably heard them. Pathology, pharmacology. So we do learn about prescription medicines. We learn standard of care and how to write prescriptions and how to taper off and all the things your medical doctor has to learn as well. We do learn that in school. The second year is when you start learning your clinical disciplines, just like in medical school. In other words, how to start utilizing that knowledge, how to take lab results and a patient history, and how to diagnose, so to speak, even though we're not treating disease, but we still diagnose because that's what you do. How to look at all those things, how to look at imaging and the history and just all that clinical type care we start learning in the second year. Laboratory diagnosis, radiology, how to read those sort of things. In the third year, we learn about the third year is we start introducing the naturopathic disciplines, and I'm going to talk about that in a minute. Like I said, those are the modalities that are in our black bag, okay? Our treatment options, okay? So conventionally, most of the things are drugs, surgery, maybe some minor lifestyle changes, but we have a lot more things in our black bag that we can utilize, and that's what I want you to know, so you know that there are a lot of other options out there that can help you. And then we get the clinical experience in the third and fourth year. Just like medical school, we start seeing patients, learning how to conduct a visit, learning how to do a physical exam, all of those sort of things. Medicine is definitely an art. It's a science, but it's definitely an art that comes with experience. So that's a little bit about our 4 years in school. We do have to take boards after the second year and after the fourth year. So you have to pass all your board regulations, okay, to become licensed in whatever state you're going to be licensed in. I'll make a point, I don't have a PowerPoint on this, but in the United States, every state is different. Kansas is a licensed state, so naturopathic doctors can come to Kansas, so to speak, I guess. There are a lot of states that aren't licensed. So what that means, there is no laws. So basically, this is where the problem arises in some states. People call themselves naturopathic doctors, but they haven't had the training. Since there's no laws, the public doesn't know the difference. And so there are things that have happened that you might have heard about. A lot of times it was from more of an online, like Clayton College or I think in Alabama or something like that. They're like online year programs that you purchase. okay? You just got to be cautious about that unlicensed state. Kansas is licensed, so you don't have to worry about that here. Only medically trained or 4-year doctorate program naturopathic doctors can work here in Kansas. So, and every state's different. Arizona, California, Oregon, Washington have a lot bigger scope of practice than Kansas. Kansas, I'm limited in some things, but in other states, we pretty much work as primary care. In Arizona, I trained as primary care. You can basically do anything a primary care does, including minor surgery and stuff like that, because we do learn to remove cysts and do stitches and all those things. So Kansas, I can't. Although I love doing that stuff, I can't stitch you up here in Kansas. But okay, so that's a little bit about our education. Any questions on that particularly? Did I touch everything? Anybody have any questions? No? No questions, Hannah? Okay. Excuse me, my mouth is dry. Okay, so these are the naturopathic disciplines that we learn in school. We get patients calling all the time, well, how are you going to treat this? How would you treat that? And the reality is, and you'll see in a minute, I'm kind of going off a little bit here, but we treat every patient individually. There's no, of course we learn standard of care for things like high blood pressure or, but I don't treat every Parkinson's patient the same. I don't treat every patient with migraines the same because they're not the same person. The cause is different. They're completely different backgrounds. So anyway, I'll talk about that in a minute. But these are all the different things that we utilize on top of pharmacology, which are prescription drugs. Clinical nutrition, okay, so that's dietary changes, supplements, oral supplements, intravenous supplements, intramuscular supplements, or vitamins, and there's different times where IVs and IMs are warranted over oral supplementation. And we use clinical nutrition not in the sense of, more in depth than what a nutritionist would do, because what we're looking at is, we learn what nutrients are a part of what pathway. And so we can tell, you're low in magnesium or B6, you need to eat these foods to help make more serotonin. That magnesium and B6 are part of serotonin production. So we do a lot of education on nutrition in that aspect, okay? So we do botanical medicine or herbal medicine, okay? So utilizing herbs. So we can use herbs as a Band-Aid, so to speak, using like prescriptions, here, take this for that. But that's not really why we use herbs. We use herbs more for long-term regulation of things, of hormones especially. Herbal therapy is great for regulating hormones, but it's a therapy that has to be taken for, 2 or 3 months. But I explain to people it's all about regulating things, not shutting things off. We're not giving you a natural supplement to shut off a pathway. We're giving it to you to promote the better pathway or to get the body regulated properly. And I'll give you some examples of that in a little bit, okay? Well, I'll go ahead and give you one now. For instance, you probably have heard fish oil is a great anti-inflammatory. Have anybody heard that before? Fights inflammation, right? So you've probably heard so is aspirin or ibuprofen, right? It's an anti-inflammatory. The difference is one shuts off a pathway, a COX inhibitor is what they call it, the ibuprofen, and then one promotes a pathway. So the fish oil promotes the pathway that's anti-inflammatory. So it pushes that pathway that you're having problems with, because most people are deficient in a lot of these great things. So we're trying to promote the good pathway, not block a pathway. Anytime you block a pathway, you're going to have problems, because that pathway is there for a reason. Your body is so smart. You have these great mechanisms, and you don't want to block something long term. Okay, over time, it's not good. Traditional Chinese and Oriental medicine we learn in school. So I took a lot of Oriental medicine. It's very complicated. I'm not going to talk about that today. I don't utilize acupuncture. I was trained in it, and I can do a little bit of acupuncture treatment, but I know a lot of good professionals in the community that I would rather refer to do more hardcore acupuncture treatments. Acupuncture and Chinese medicine is fantastic. And a lot of what they knew thousands and thousands of years ago is very parallel to this new scientific breakthroughs that we're making now. So they're very intelligent, just by observing and listening and watching people. So we learned that. We learned homeopathic medicine. I do not utilize homeopathy at all, except on a couple things in my practice. A lot of times people think naturopathic and homeopathic are congruent or the same word. They're not. Homeopathic medicine is, again, a treatment in our black bag. Okay, so that's the difference. I probably should do a talk on what homeopathy is one day, but I don't utilize a lot. I do for like poison ivy and just acute type of things. I'll tell people to go get a homeopathic remedy because I know it works, and it works all the time, but I don't use a lot of that. Naturopathic and lifestyle counseling, of course. We do a lot of that. I do a lot of that here. And it's not just, okay, now go eat better and exercise. And, sometimes people sit in my office and they're shocked at the things I tell them. I said, I don't want you doing a lot of exercise right now. And they look at me like, but it's so good for me. And I have to explain, well, this is what we're trying to do. We're trying to heal your adrenals. You're burning yourself out. I want you to take a rest. I want, so it's not always about just exercising and diet. There's so many other things in the lifestyle that you have to look at. Environmental, social, many, many other things besides food and exercise, okay? Much more in depth. And hydrotherapy. This is one that I see always gets forgotten. It's simply hydrotherapy. Does everyone know what hydrotherapy is? Therapy is in water, or hot and cold. The best anti-inflammatory for knee pain is ice pack. A lot of these things are forgotten. If someone's acutely injured, they'll take anti-inflammatories before they get the hot, cold treatments. And a lot of times that works way better than any medication or any supplement, and it's free. So I educate my patients on all that. I'll have them do things at home that's related to hot and cold. And of course, it's the most, what word am I trying to use? Takes a lot more time, takes a lot more energy to do that sort of thing. So I see the compliance not so good with that, but I'm working on patients and knowing how great and the benefit of it, so they'll start doing these sort of easy modalities. Okay, so that's a little description about our naturopathic disciplines. Does anyone have any questions about that, or concerns, or feedback, or anything? No? Okay. All right, so these are our principles. So this is kind of, I've touched a little bit on this already, bits and pieces about, This is basically what is naturopathic medicine, all what I'm about to go over here. So first, you do no harm, and I'm going to review all these individually. First, do no harm, of course. So you're probably thinking, isn't that common sense? Well, you would think, but all the Latin's on the right side. So first, do no harm. Identify and treat the cause. Okay, and that might take some time, and we might need to do a Band-Aid at that moment, but you still need to work on identifying and treating the cause all the time. Support the healing power of the body. Again, I think we forget how powerful nature is and how amazing we are, and that our bodies are meant to work properly, and we want to support that mechanism. You treat the whole person. And I don't just mean you come in with a headache and I'm going to treat. I want to know all your physical symptoms because that helps me get to the cause, but also the whole person, psychologically, socially, we're going to go over all that in just a minute. Doctor is teacher, okay? Doctors are teachers, and that's something that's forgotten a lot, okay? A lot of patients tell me they're scared to ask their doctor something, or they get snapped at if they do. But we are taught, and these things are drilled in us in school. Doctor is teacher. Emphasize prevention, okay? All right, so, I think these got out of order, my bad, sorry. First, do no harm. And your PowerPoint, I apologize, that's on your desk is a little different than the ones up here. I made a little error before she printed these out, but I fixed it up here, so I apologize about that. Some things might be out of order. All right, so first, it's the same? Oh, you printed them out. Oh, never mind. She reprinted them. I apologize. Thank you, Tiffany. Okay. First, do no harm, okay? So, of course, if a treatment is going to cause more harm than the disease, we're not going to do it. We don't want to cause, more problems in a patient. Like, for instance, I have a patient I did put on a prescription medication, and they want to get rid of this symptom, but I'm like, this can cause way worse problems in you. I want you to be aware of that. We'll do it. and you're going to check in with you, but I want them to be fully aware that the side effects could be way worse than what their problem is. And that happens all the time, and the lack of communication to people about that is not there. And people don't realize that they're not making informed decisions, basically, okay? So we try to explain that to patients. So, all right, first, do no harm. Let me skip that. Identify, I'm kind of behind. Identify and treat the cause. Of course, you think that everyone would do that, but that's forgotten a lot of times. You know, a lot of times we think everything's idiopathic or where it just happens, or we don't. I want people to realize that there's always a cause, whether or not you did it or it was an environmental cause or just something's going on, but there's always a cause that we can actually, investigate and try to figure out. Okay, so we want to alleviate the acute and chronic symptoms. It's not like I want someone to be in pain or to have horrible night sweats and hot flashes, that their life's, interrupted. We're going to try to treat those symptoms, but we're still going to work on the cause of that at the same time, okay? So that you don't have to rely on medications, that you don't have to be on bioidentical hormones, which is a great treatment, but I tell patients, after 2 or 3 years, you want to come off. You want to treat why your body's reacting this way, and then come down off the hormones. I mean, that's my goal, and that should be everyone's goal, for your body to work properly. Symptoms are viewed as the expression of the body's natural attempt to heal itself. That's something that's forgotten. A symptom is your body trying to heal. And probably a lot of times we don't think that. You're coughing. I get this all the time. My child is coughing. What's wrong? And I have to explain, when you get a virus down in there and you get mucus to catch it, you cough it to get it up. I mean, that's the body healing. You get food poisoning and you're having diarrhea. You don't necessarily want to stop it, and you want to make sure you're not getting dehydrated in those things, but you want to get it out of you. You don't want to keep that in your body. Is getting it out for a reason, okay? So we try to treat the cause and not just stop the symptom. Okay, and the cause can be diet, lifestyle habits, life events, physiological imbalances, environment, toxicities, or a combination of them all. Okay, and it just takes a lot of talking, and really within an hour of talking, I can kind of figure out the cause of what's going on with the patient. Okay, you might want to do some labs, nutrient testing, things like that to confirm, but a lot of times we have those ideas in our minds. Okay, so I'm just giving you an example. So a case of eczema, treating the cause. They always come with their steroid cream. And of course that's going to help the symptom and going to get it away, but you still want to focus on getting to the cause. And again, you have to treat everyone individually because the cause can be different. And I wrote some examples of eczema, for instance, that I've seen in my practice and in my experience with causes of eczema in kids upwards to adults. Constipation and poor digestion, 90% of the time, is always a factor. Okay, and I always make sure, people say, "Oh, I'm not constipated," and I'm like, "Well, tell me about your bowel habits," because they don't know what constipation is. A lot of people don't. I'm like, "Yes, you are." So that's a problem. Food allergies and food sensitivities, that can be a problem, and I explain to patients why you're developing allergies. Your body just doesn't react to food, but there's a whole reason why you're developing allergies. So you want to avoid the food allergies, but then you want to heal the body so you don't develop the allergies again. Compromised liver function, detox, and stress, of course. And stress causes everything, okay? And I try to educate. I try not to say, "Oh, your cause is stress," because everyone says, "Oh, you're just stressed." I like to tell patients, well, this is what it's doing to you. This goes back to now the doctor as teacher. In a minute, I'm going to talk about that. Well, this is why stress is causing your problems. Because when I do that and I say you're stressed and it's causing, this and this problem, this is why your adrenals are off and your blood sugar, you're having hypoglycemia and now you're pre-diabetic and all this stuff because of stress, they look at me like, "Oh, well, why didn't someone just tell me that?" Or another, I'll tell you that in just a minute. I'm going ahead of myself. But that's an example of treating the cause. The healing power of nature. So if you're, the body, we want to give the body everything it needs to heal. So for instance, if you're baking a cake and you forget the baking powder, are you going to start putting other stuff in it to try to make it rise or whatever? No, you're going to put the baking powder in. But you're going to figure out that's what you left out. You're going to go back through your steps, and that's kind of what we try to do. Where you're not having energy, well, are you getting everything you need for your body to make energy? You know? And if you're feeling tired, guess how your cells are feeling? Your cells are feeling tired, and that's why you're not making your hormones, because they don't have the energy to make them, right? So that fatigue is yeah, you're tired and you want to have more energy, but you're going to start having other symptoms because their cells aren't getting the ATP and energy they need to work. So, okay, so healing power of nature, okay? Your body does heal. You cut, it heals. You don't need to put anything on your cut, okay? It will heal itself. All right, I don't need to go over that. Treating the whole person, I talked about that already. So you come in with chronic migraines, your head, I'm still going to ask what's going on with your pinky toe. You know, I want to know everything happening because it helps me figure out the cause. And then also, emotionally, mentally, socially, environmentally, genetic problems, spiritual aspects. I mean, all of that needs to be addressed because a lot of times people don't realize, especially mental emotional disorders, a lack of emotional and spiritual side of them is one of the underlying root issues of what's happening. So you want to treat the whole person, okay? A lot of people don't realize that that's all part of them, all of those things. All right. Okay, so an example of this, one person's eczema may flare up with stress, requiring treatments focusing on counseling and stress management techniques. Another person might have the problem because of temperature changes. I mean, there's all different causes, and we want to figure that out so we can treat that person. I don't want to just keep giving Band-Aids because it's doing them a disservice. So doctor is teacher. Education is power, basically. I mean, it really is. Once you know and understand what's going on in your body and understand what's happening, I see patients have that sense of hope and that empowerment that don't have to be like this the rest of their lives, that they can start, that they do have a control. A lot of times people feel very out of control, and I try to give that back to patients because they are in control of their life. We encourage self-responsibility for their health. That's kind of like the co-learner thing, okay, that we do at the Rooting Clinic. So spending time explaining the causes, I told you one example of what is happening in their body, but for instance, this week I had a patient who, had this chronic cough, and they said, well, my doctor keeps telling me it's reflux, and I don't have heartburn, I don't have any of this issue. And so I took the time to explain why the doctor was saying it was reflux, what's happening and why they're having that cough and why they need to take what I'm telling them to take. And they just had that sense of, and this was actually one of the free visits that I did for the Check Your Health thing, but they had that sense of, wow, why didn't anyone tell me that? Why didn't they tell me? They kind of felt like, if I would have known that, well, I would have done these changes a long time ago. So when you start educating, you empower the patient to not only trust you, that you know what you're doing, but they understand their body, and then that they actually do these changes so they get better, okay? So doctor as teacher, role as we're the health coach. We place responsibility on the patient. Okay, that's the one thing I don't like. I tell patients, I'm here to guide you, but I'm not God, and I'm not like this magical person. You have to do all the work. Okay, I'm going to give you the education, but you have to do all the work. And doctor actually comes from the Latin word docere, which means to teach. So anyone who's a doctor has the ability to teach. They had enough education to teach, and that's our responsibility to do that. So I got to say, I spent a lot of time educating. Probably too much, but anyhow. Health promotion is the best prevention, okay? That's just one of our last principles. Prevention is not just, of course you want to do your screenings and catch things early, but we really want to prevent all these things from happening. We want to prevent cancer. We want to, prevent all these, especially cardiovascular and diabetes and all those problems that are 100% preventable if the patient has the education early on. I see that, again, once they're educated, they want to make the changes because they know, right? Kind of like when you're a kid, you ask mom why, and she goes, because I tell you to. You just want to know why. My son was doing that the other day. I mean, you don't always have to say why, of course, but I think this really empowers the patient. And you know when you know why you're doing something, then you tend to do it. So, okay. So that's a little bit about our principles. And as a naturopathic doctor, these things are really ingrained in you when you go into clinical practice, that you're following these principles. It's not just, following standard of care, but we go back to our attending and making sure we're hitting all these principles, okay? Especially the next thing I'm about to tell you. This is our therapeutic order. So that was kind of what our medicine is based upon. But this is kind of, in a sense, the art that I mentioned. How we have the science, but this is how we address patient care. This is the steps we take. And it's not like, in the beginning when you're in school, you go through these steps. They teach you that. But when you get to clinical practice, you do it in your mind, and you do it like this. You figure out which step you're going to start on just in that first visit, okay? But this is kind of where we go because, let me review them. Identify and remove the cause or obstacle. That's the first step. So if you come in with eczema, I'm first going to figure out, is there something causing it? Is there, of course, you have eczema, they're going to ask you, what do you wash your clothes in? Are you using dryer sheets? What lotion are you using? You go through all that first, right, so that you can stop doing it. Establish a healthy regimen. Okay, so first, get on a healthy lifestyle, because those two alone sometimes, patients are better. For instance, sometimes with a patient, I'll say, here's all these, I said, look at your diet. These are all these chemicals I see you eating. I know they cause migraine headaches. Take this, start removing them. Because a lot of times, people don't want to go through a lot of lab testing and stuff. I say, start removing them, and let's see what happens. A lot of times, they'll come back completely gone. I had a little girl with epilepsy, and the parents took her off the medication. I didn't tell her to, but they just did the dietary and lifestyle changes and stuff, went back, and everything was completely normal. So we only had to get to step 2 there, okay? Stimulate self-healing, okay? So you establish a healthy regimen. Once you got that going and things aren't getting better, then you want to stimulate the self-healing, okay? And I'll give you examples in a minute. Strengthening weakened immune system, weakened symptoms. So immune system, GI, gastrointestinal. If that's not working, you're going to have problems all over the body. Your endocrine system, that's your hormone system, balancing hormones. Correcting structural integrity. So you could have some physical problems going on. We learned, I didn't put this in there, we also learn physical adjustment, not like a chiropractor, but we do physical adjustments. I don't do them here. We have a chiropractor here, but looking at that, looking at your structure. Restore and regenerate, addressing pathology. Sometimes you got to address the pathology. You already have it. You have to start at number 7. And sometimes you got to start at number 8. If a patient comes in with thyroid cancer, and I know it's 100% curable and a 20-year success rate because they removed the thyroid for this cancer, I'm going to say, let's remove the thyroid. I'm still going to, you want to put the patient in their best interest. You might not want to do surgery, but in my opinion, it would be better to go ahead and do that. And then you do that, but then you have to remember what caused that cancer. I still tell patients you want to go back and figure all that out because you don't want to prevent a recurrence or a cancer somewhere else or a problem, because that happens. And one example I see in older people, and you do a history, especially with autoimmune problems, normally you'll see like rheumatoid arthritis and things like that. You'll see eczema as a baby, then you'll see asthma as a kid, and then you'll see digestive constipation the whole time. And then they'll start developing inflammatory arthritis and things like that. But not always, I'm not going to say always. Most of the time, you'll see that trend in people. If you don't address it, it comes out somewhere else. Okay, something's wrong. Don't suppress it. Don't just take the ovaries out if you got ovarian cancer. Well, you can take them out, but you still want to go back. So that's what we're taught. Okay, you still want to go back and do all these steps. And so that's a little just a brief description about our therapeutic order. And then on these slides, I kind of go through examples again, and I'll do that. I'm not going to get to all of them, but there's a lot of information on what we do, that just to give you an example so you understand. I don't do everything with every patient because you can't. But you have to utilize your education and what the patient tells you to know where to start and all that. So again, this looks kind of complicated, but it happens usually within 30 seconds to a minute, deciding where you're going to start, okay? And I do try to spend time telling patients about this, but I don't always get the chance to. So So removing obstacles to cure. So, I mean, I just kind of I gave you some examples already, but this is for you guys to take home and look through, you know, things like cigarette smoke, food additives, chemicals, pesticides. You know, when a woman comes back and does our female hormone panel, for instance, and their liver metabolism is showing that they're not metabolizing things right, I go and show them on the other sheet, well, this is why pesticides are not good for hormones, because it's affecting here in the liver, and that's why you're having high estrogen symptoms, or getting, you know, fibrocystic breast, or you have breast cancer, or endometriosis, things like that. And that helps them realize that, you know what? They're right. I need to avoid pesticides. You know, I need to start getting this out of my diet if I want to cure the endometriosis, okay? Formaldehyde exposure, that's a problem. That's all over the place. Recognizing and avoiding emotional toxins, that's another one. Okay, that's, again, going to treat the whole person. A lot of times there's relationships that are bad, and I got to start, you know, I'll do counseling with patients. I mean, I try my best. I'm not a certified psychologist by any means, but I do counseling with patients to help them start seeing that and to realize it does affect your physical health. Your emotions affect your physical health, absolutely. So that's negative people. Sometimes I have to tell patients, you know, to consider if it's affecting your health. You might have to tell them, or if they don't change, then you're going to have to say no and, you know, end relationships that aren't healthy. Okay, establishing a healthy regimen. That was the next step. So with a patient, the next thing you want to do is make sure they understand what a healthy regimen is. Most people don't realize what is good and what is bad because there's so much information out there. So I try to look at their diet, look at their lifestyle, get them eating better. A lot of times people are very surprised the information I tell them. When I tell them to eat eggs, they look at me like I'm, eggs? Really? I thought they were bad for me, you know? So there's a lot of information out there that people aren't aware of, that they think they're eating healthy, but they're not, because they're eating healthy choice meals. You know, the marketing kind of warps with people's minds a little bit. And I think almost every patient I've told, don't get your health information from marketing. Okay, not good. Well, there's some good information, but that's not where you don't want to rely on that. So healthy thinking, healthy relationships, healthy work environment, and that means chemical exposures as well as how you interact with your boss and your coworkers. A lot of times, just through counseling, the main issue of a person is their boss. You know, I mean, it's causing problems, and then you got to get them to realize that, because a lot of times people don't realize that, especially when you're in a depression. You don't realize a lot of these things. In a healthy home. Okay, so then we go and we strengthen all of our systems of the body. We want to focus on that. So your immune system, so that's your white blood cells, fighting infection, immune systems, we always see weakened immune systems in people. Liver and detox, you know, if you're not, we're going to be exposed to toxins. You can't live in a bubble, but you need to make sure that your liver is working properly so that you are detoxing things out, and then you need to be aware so that you can start removing things that you have control over. You can't control everything, unfortunately, but we can at least remove the things we can control. And that's why I always start with the food additives, because you can control that. Unless you're in a nursing home or, you know, you're a kid and you can't, you're completely dependent. Unless you're completely dependent, you can't control it. So balancing hormones, digestion, absorption. So, and then what I've done is I've gone through kind of little examples of how to stimulate the immune system. This is basically for your information to take home, just to kind of give you some education. Again, education is power, so I try to educate all the time. So this is for you guys to read through. Lots of colorful vegetables. If you can go home with anything, think colorful vegetables, okay? It's very important. God was, or whoever made the earth, was very smart. He colored everything we need to eat because we like color, right? We like M&Ms, right? We like cakes with all the colors on it. That's what kids like. They know how to market to kids because the anthropologists know we like color. So you want to focus on as much color as you can on your plate. So you have a salad, put blueberries on it, put strawberries on it, put bell pepper or whatever. Just get as much color as you can. And then you're going to rest assured you're getting all the nutrients if you get all the colors. Okay, vitamin C, vitamin C, vitamin C. Okay, we're known for our vitamin C, but you can't ever take too much of it. Well, yeah, I guess you could at one time, but vitamin C is always good. Zinc and probiotics, great way. good bacteria for your gut. You don't realize a lot of your white blood cells are made in your gut, 80%. So if there's gut problems, there's going to be immune problems. That's why you always, not always, you might hear, read, you treat the gut, especially for autoimmunity, rheumatoid arthritis, lupus, all the other autoimmune diseases, Hashimoto's, Graves' disease, all that stuff. Treat the gut. So you want to improve digestion, eliminate parasites and yeast overgrowth. And these are just some herbs I just kind of wrote down for FYI, for your information, that stimulate the immune system.
Filtered water. Do you have a favorite water filter to recommend?
Filtered water. The question is, do I have a favorite water filter to recommend? I don't have a necessary favorite. I just you want to make sure you're filtering all the chemicals out. You know, fluoride, chlorine, well, we don't have fluoride in our water, but chlorine, all the bacteria and things like that. Make sure, especially the chlorine in the water, it's very important. I don't have any special filters. I mean, they have a lot of different ionizers out there, like Kangen water and things like that. Those are great, but you also have to remember you still need to filter the water. So Kangen water is very alkalinizing, which is great because it gets into your cells better, but you still want to filter it because if you're not filtering it, it's going to just bring the chemicals right into your cells that much better. So you want to make sure you always have a filter too. But an alkalinizer is great. Yeah, those are good. Ionizer that alkalinize the water, those are a good thing. But make sure it's filtered first. And bottled water is not always the best. A lot of times bottled water is just tap water. People don't realize that. A lot of it is just tap water. Again, marketing, they'll put a little mountain on it and make you think it's good water. But I don't mean to laugh, but it's funny to look at marketing and how, huh? Actually, probably the best water is Fiji water. Fiji is probably the best filtered, most alkalinizing water that you can buy in the store. Fiji water. It is the most alkalinizing. We actually did a test on it. So, improving your immune system. Sleep. Okay, that's the easiest thing. But, you know, of course, people always say, well, I just can't sleep. You want to make sure you're sleeping in bed. Early to bed, early to rise makes a man healthy, wealthy, and wise. Very, very famous saying. Everyone I know has heard that before. Who hasn't? Everyone has. And there's a lot of health reasons why they say that. It's your circadian rhythm. You go to bed with the sunset, you wake with the sunrise, you're going to be way healthier than someone who doesn't. And when people say, I'm just a night owl, I'm like, oh, no, you're not. We're not meant to be night owls. Thomas Edison made us night owls. We're not meant to be night owls. We can regulate that. It's self-discipline. There's a lot of herbals and hormones and stuff we can start utilizing. Because it is hard sometimes once you get to that point to do it. But there's some things we can start manipulating. And sometimes you don't have a choice. You work late. You have the third shift. You know. But I've had a lot of patients who had to quit those jobs because their health got so bad. I'm like, is the money worth it? You know, to feel like this, so they ended up having to switch jobs because of that. So that's very important. Hot and cold showers, again, water, very important. Hot, cold, stimulating the immune system, fantastic way to stimulate your immune system. Shunning the blood in, out to your surface, that is so great if you do that. Always end in cold if you do it. Never end in hot. I know that sounds frightening, but always end in cold. Okay, you want all the blood shunted to your internal organs. It's great for adrenals. If you have adrenal fatigue, great for adrenals. Put it on your back, right over your adrenal glands. Fantastic for adrenals. Deep breathing. Something simple. A lot of us you're probably holding your breath right now, huh? Listening. You do. We hold our breath a lot, okay? And that's when you start yawning, when you're holding your breath, you're not getting oxygen in. And deep breathing also stimulates the lymph system, okay? And that's getting toxins out. Your main lymph organ is right under your diaphragm. Every time you deep breathe, you're stimulating the lymph flow. Extremely important. So don't, all these little things seem like, oh yeah, whatever. Extremely important for health that you can start doing right now while you're sitting here, okay? Avoid stress, excess fear, anxiety, and depression, okay? It's easy to say, but you want to try to avoid it or at least learn how to handle it. Of course, you're not going to take stress out of your life, but you got to learn how to handle it and how to change your viewpoint on your stress so you don't have anxiety and depression. Decreasing inflammation, I talked a lot about that already, a little bit about fish oil and inflammation and how we push the pathway, not block a pathway. Again, we might want to block a pathway. In some instances, if you have an acute injury to your knee, We want to ice it, and we might want to block it for a few days because the inflammation can damage your knee. But there's always a time and place. You don't want to be on it long term. If you have a ulcer in your stomach, you'll want to be on a acid blocker short term. But again, read the label. Those are only meant to be used for a month to 2 months, not 15 to 20 years that I see patients on acid blockers, reflux medication. Okay, you don't want to block things long term, okay? Not good, causes health problems. Okay, so these are just some examples. Again, eating a colorful diet decreases inflammation too. So if you can do anything from an inflammation standpoint, from a dietary, is a colorful diet, getting the bad fat out, and which are margarine, Crisco, the fake fats, and giving your body the good fats that you need, the essential fats, the fish oils. And essential means you have to get it from your diet. Your body cannot break down fat for it. So most people, especially in Kansas, do not get essential fats because they're not eating grass-fed beef and fish, salmon, and stuff like that. Okay, fresh fish. Herbs that are anti-inflammatory, that's just for your information, okay? Those are different things that actually help with inflammation. And these work really great too, by the way. Boswellia is fantastic. That's what frankincense is. You know, frankincense and the 3 wise men? That was Boswellia, a great anti-inflammatory. Good enough to be a part of the Bible story, so it must have some great healing effects. Okay, improving liver function and detox. Okay, decrease toxicities. Again, that's removing the obstacle cure, avoiding food additives, making sure you're having regular bowel movements. Something as simple as not being constipated anymore can totally turn your health around. Okay, hormone changes, I mean, you name it. And it's all figuring out why you're constipated. Okay, so these are just some other examples for you guys to take home. Better digestion. You always want to have, if you're having a lot of gas and bloating when you eat, or feeling heavy after you eat and uncomfortable, it's a sign you're not breaking down food well, and we want to figure out why that is. Okay, because you're going to have more inflammation. Balancing hormones. Okay, and again, I just want to reiterate, I know I've said this a lot of times, but we do all of this at the same time. We're kind of working on all of these symptoms at the same time with people. So you got your adrenals, you got your thyroid, you got your blood sugar hormones, you got your female hormones, you got a lot of hormones, okay? It's not just about you think hormones, you think female, like estrogen, progesterone, testosterone. So many hormones. There's hormones that regulate your appetite. And those are the hormones we're resetting with, like if you've heard of HCG and stuff, we're resetting those appetite hormones. Okay? And those are just some herbs just for your information that help with those certain areas of the body. The adrenals are extremely important to help with chronic fatigue. All right, so that's a little bit about kind of our, let's go back, our therapeutic order, okay? But again, we still, as naturopathic doctors, can address pathology. You know, we know when to order a CT scan, when to order an MRI. You know, we can refer to a neurologist. We will do those things, you know, and I still try to, I want patients to be informed. So even if I have a patient that comes in with a cancer diagnosis who does not want to do any conventional treatment or see an oncologist, I try to get them to at least go to a visit, know their options, okay, and not ignore, know the options, and then make a decision, because you always want to be informed, because I see that a lot. And I don't want to push them. I want to say, you know, you can make your choice, but I want you to be informed, okay? And there's still some people that won't do it just because of experience with family members, but I still like to say that. So we do all that too. I'll refer for a lumpectomy if I need to, if I think they want to remove the lump out of their breast or whatever it is. So we do all that as well. Okay, so I'm kind of going around in circles here, but so this is a little bit about what to expect when you come in for a visit. Okay, it's, you know, we normally spend about an hour to an hour and a half on the first visit, just like I ask a lot of questions. I go over all the paperwork you fill out. You know, if I'm going to want to know everything, and I tell people that, you know, tell me at the end. I always say anything else, anything. I don't care if you think it's related or not. And sometimes people are like, oh, well, back when I was this happened, or yeah, and I'm having this problem. And sometimes that's the missing link to the puzzle. So I always say, tell everything. We do a physical exam. I'll review past labs. We learn lab diagnosis, how to read labs, all that stuff. Pathology reports I'll review. I'm not a radiologist, but I am, and can read your scans, but I can read the pathology reports and explain that. I try to explain that to people too, kind of go over. I'm kind of like a lot of my patients come in and they want me to explain everything else the doctor's doing, and because they want to be educated, and the other doctors don't have time, or they're intimidated, or whatever. So most of the first visit is a lot of listening and gathering. Does someone have a question? Yeah.
Is this covered by Medicare?
By Medicare, my personal visit here in Kansas is not covered by Medicare. Some of the laboratories and stuff that we do is covered by Medicare, but not the visit, unfortunately. Not yet. We're working on all that. Some insurances, yes. Okay, most of the first visit is listening, and then we develop an individualized plan, okay? Whether we're going to do labs. Sometimes people are like, I can't do any labs, so I'll work with that. And we'll start with addressing that therapeutic order. Where can we start? What do we need to focus on? Okay, so we're kind of running out of time here, but we treat people rather than conditions. Of course, we use the terms because we have to communicate diagnoses and stuff, but we treat people. I treat a person who has cancer. I treat a person that has a migraine. So we're treating individual people. Because I get calls all the time, how do you treat migraines? I'm like, well, sometimes you don't know how to answer that. I try to explain this is the therapies we utilize, but everyone's always a little different. And again, we're not alternative. We can work as part of your healthcare team, okay? All right, and so I like hormone imbalances, gastrointestinal problems, life diabetes and stuff like that, but I like the really complicated ones a lot. That people have all these things going on and no one can figure it out. So clinical success, I see 4 weeks old all the way up to people in their 90s, all different types of chronic conditions. We don't see a lot of acute stuff, so if you're coming in with a 106-degree fever and I'm going to send you to the emergency room, but I do see acute things like flus and viruses of my current patients and stuff. So these are some of the things that I've had clinical success with. So, stop and ask I tell people, are you tired of feeling miserable? Are you sick of being sick? Then if you want to figure out what that underlying problem is, then naturopathic medicine is probably what you want to seek or have on your healthcare team. It doesn't mean a lot of people have this sense of I'm going against my doctor or I'm going to hurt their feelings or, one of those things like, that's not it. You're having someone else in your healthcare team, and I honestly think that's a good thing. You want more minds going over your health. You want more opinions. I told one mom one day, I was like, if that was my kid, I'd go all over Wichita getting other opinions. There's nothing wrong with that, and you can see as many doctors as you want and get their opinion. So, when to refer to an ND? Someone who's interested in complementary care, is looking for additional support and counseling to maintain and improve their health, is having a lot of side effects of medication and want help with side effects, or the medications aren't working for them. A lot of people, blood pressure medications don't work for them. And then they have all these side effects and they need other help and the doctors don't know what to do. That's when you would want to come see a naturopathic doctor, or the doctor should refer at that point. You're on a lot of herbs. I see people who are on a lot of supplements and then they don't know what's helping and what's not, and self-medicating, and they just want some guidance. So I sometimes have patients that come in just for that. I'm on all these things. What should I take? What do you think is the best? Poor success with conventional options. People that have digestive problems probably should always seek our help because a lot of everything starts in the GI tract. And gastroenterologists do not address that. They address structural problems. They don't address the function and the digestion and all that going on. Anyone who needs advanced nutritional advice, they're on medications, they can't eat, they have, especially elderly, they can't chew foods, all those sort of things that they need more dietary advice on. Poor immunity or viral infections. That's basically when to refer. These are some websites that you can go to, has some great information. That first one is the national website, and that you can go online. Say you have an aunt out in Vermont that wants to see an ND, you can go on there. They can see how many are in Vermont and how to find an ND doctor. All our information's on there. And those are just some of the schools websites that you can visit to get a lot of information on. So that is, I am cutting it right at an hour. Look at that. That is, I hope you guys got a lot of information, a better understanding of what we do. I mean, the take home is, again, we're kind of a combination of both worlds, and just not alternative, but we're just someone else on your healthcare team that can help you reach your healthcare goals. A lot of times I ask a patient, what are your healthcare goals? And they don't have goals. They don't know what they are. And so we try to set those goals and reach the goals. So thank you. And if there's any questions, feel free to stay after. I'll stay for a while and try to answer your questions if you have any. Okay?